walk in the door, and while you think you have an idea what's going on, the reality is you don't. And so that's absolutely terrifying to think that you may come up with something that maybe they can't fix, or it's going to be more serious. So it is terrifying.
When I got over there to the clinic and she said, well, your results came back. Just want to let you know that you do have cancer.
We should treat the patient as if we're walking in their house instead of them walking in our house, and that we should make this the patient's home while they're here.
I am terribly claustrophobic. I have never been able to go through a standard MRI in my life, and I needed one. And it was the staff person in that MRI room, the way that he just spoke to me, the way that he treated me. The test came and went, and while I remained terrified the whole time, I was able to complete that test purely because of his over and above, his attitude, the way he talked, the way he handled the exam, and I've never been able to do that in my life.
Before my surgery, they even called back to say, do you have any questions? Do you understand everything that's going on? Everybody was just great. From the person who registered me to the person in radiology who, do your markings and everything that they do behind the scenes.
At a baseball tournament, I woke up feeling chest pains. My mom started feeling around my chest, and she could hear cracking sounds.
They came in and started examining him, and then they just told me what tests they were going to order. They came to the room and did the EKG right there, and they actually told him exactly what was going to happen to him, so he wasn't nervous when the equipment came in.
My brother had called and said that his car wouldn't start. Could she come and pick him up and give him a ride to work? So she told him yes. Well, at 7:30 he called me at work and he said, she's not here. Can you go check on her? So I got inside the house and I started calling for her, and she was in her bathroom off her bedroom. She had gotten that far, and she was sitting on the stool and she could hold herself up between the tub and the sink. But she couldn't talk. She didn't know who I was. There was no response whatsoever.
VHHA, we talk about the 4 C's, and we talk about it that way as an easy way to help people remember what's important to taking care of patients. The first thing is caring about that patient as an individual. The second is compassion. Bring your whole self to work as a human being. It's about comforting the family, comforting the patient. That might be with pain medication, that might be with a conversation, and it's about patient-centered. We cannot have what I call cookie-cutter plans of care. It's really about that patient, their plan, their family.
Took wonderful care of my family, and I'll have to be careful. I'm a very emotional individual, and I get emotional about that, but when they came out to talk to my family, came out to talk to my wife about the surgery, they always took time to talk to my children.
So you look at it from a perspective of, if that was my family member who was going through this, how would I want them treated? And it's all about respecting the person.
When he was down for an x-ray and I was waiting, the staff came out to let me know exactly how long it was going to be and that he was doing fine. And that was one time that he was separated from me, and so of course I was anxious, and just them taking that minute to come out in the hallway to let me know he's doing great and he'll be done in just a few minutes, it just made such a difference.
So how's your mom?
She's wonderful. One of the things they did here that was so helpful for me is they had a board in the room, and they would write me notes, because I would come at night. I work all day. So when the doctors were here during the day, or when, the most of the therapy was going on, I wasn't here. So they would write me notes and leave them on the board, and I would write them answers back or questions.
I remember going into the operating room for the actual procedure. If I made a statement or asked a question, they stopped what they were doing. And they always responded, and they always made sure that if I had a question, or no matter what it was, if I made a bad joke, they laughed. It didn't matter what else was going on in the room. It was obvious what came first, and that was the guy on the table. That was me.
Them telling me that they were there for me. They said, well, if you have questions at any time, call me. Come stop by the clinic. Bring someone with you was another thing. You know, you always want somebody there to have another set of ears there for you.
I truly do not feel like she would have been pushed anywhere else like she was pushed by this staff who knew her and knew the drive she had deep down. And they pushed her to get to be the best she could be.
The data really shows that if we can decrease the patient's anxiety, the patient can hear us talk and actually retain the information. Patients retain maybe 20 to 30% of what they hear in the hospital because it's a very anxious time. And so if we can help the patient calm down through our behavior, treating the patient caringly, letting the patient know that they're important to us as an individual, then they can retain a little bit more of that information. And we have the ability to do that in clinicians by our behavior.